Well, good morning, everybody. My name is Patrick Boyle. I'm the Executive Director of IgniteLI. We are the Manufacturing Trade Association representing all the manufacturers here on Long Island, from aerospace and defense to pharmaceutical, nutraceutical, biotech, to out on the East End, all the farms and the breweries and the vineyards. We get to represent everyone that makes a thing here on Long Island, and it's certainly our honor to put events like this together to talk about the challenges of manufacturing here on Long Island, but also offer up some solutions for some of the challenges. Chief among the challenges we think have got to be government oversight and new laws put in place that enable us to do business safely here in the state of New York. Chief, and recently, that is the HEROES Act, which New York State put in place about 6 months ago. It's going to be enacted and go into become official in early November. But this is something that we felt as if we needed to brief the manufacturers and really the entire business community here on Long Island, because these laws impact anybody with a workforce of 10 or more employees. And that certainly is a lot of the companies that live here. So without any further ado, I want to introduce our panelists. We have Barbara from Portney Messenger Pearl. She's going to be our first speaker. We have, let's see, Dennis Cody is going to be speaking second, though if he can't log in, we'll have to jump over to Alex Sarkin. So Alex, get ready. Alex represents industrial coverage. He's going to talk about the insurance challenges that this law poses. And then Jamie Moore is going to discuss some solutions, some grant solutions that he's come up with to help our manufacturers get in front of this law and become compliant with the new rules that are in place. So Barbara, I'll shoot it over to you. If you want to go ahead, and I'm going to stop my screen share. You can go ahead and share yours and we'll get started.
Thank you, Patrick. Give me a quick second just so I can get here. I hope that's nice and clear. And good morning, everybody. So let's get right into the HERO Act, because there's a number of pieces of information that we want to make sure we are covering today. So the New York HERO Act requires all employers in New York State to implement certain safety standards and to adopt a prevention plan to protect against the spread of airborne infectious diseases in the workplace. And COVID is one of those airborne infectious diseases. This covers all private employers in New York State, regardless of size. So the definition of work site in the New York HERO Act is any physical space, including a vehicle, that has been designated as the location where work is performed, over which an employer has the ability to exercise control. This applies to independent contractors who are working at your location. So let's talk about a little bit of a timeline. On May 5th, the New York HERO Act was signed into law. A month later, the New York State Department of Labor published the HERO Act standard and model language, which gives us the language to follow so we don't have to make it up. A month later, on August 5th, all employers in New York were required to adopt their plan. 30 days later, on September 4th, all employers in New York were required to give that plan to your employees and post that plan in each of your work sites. 2 days later, on September 6th, we got a Labor Day gift because the New York State Commissioner of Labor declared COVID-19 as an airborne infectious disease, which triggered the fact that your plan is now in play. So effective September 6th, your plan has to have been in place. This was supposed to only be in play until September 30th, but we've been notified that this has been extended. The designation period has been extended until the end of October. We believe it's going to continue to be extended month by month because COVID is not going away. On November 1st, it's important to pay attention to this upcoming deadline, which is coming up in a couple of days. Section 2 of the New York HERO Act requires employers with 10 or more employees to allow employees to establish a joint labor management workplace safety committee to renew workplace policies relating to occupational safety and health and to raise health and safety concerns. So employers with fewer than 10 employees are not required to allow employees to do this. If they want to, you can. but with 10 or more, employees are the ones who initiate this conversation. This means that if an employer modifies the plan after November 1st, it will need to review the revisions with this committee. Now, this committee has to be comprised of both employer and employer designees, with at least 2/3 of the committee being non-supervisory employees who have been chosen by non-supervisory staff. So it allows this committee to raise health and safety concerns to which the employer has to respond, to review health and safety policies, including policies enacted in response to these laws and regulations, to participate in government workplace site visits, to review employer-filed reports that are related to health and safety, to meet quarterly during working hours for up to 2 hours, and to allow committee members to attend a training, not to exceed 4 hours, on occupational health and safety and the function of worker safety committees. So we're all waiting for additional details and guidance from the New York State Department of Labor, which is expected to come out before November 1st. So please stay tuned. Now, next we want to talk a little bit about where we are and where we're going. So on the left-hand side of the screen, it talks about what we should have done. On the right-hand side of the screen, we're talking about we need to immediately revise and make updates to the plan. We need to address any workplace measures. We have to finalize and activate the plan and verbally review it in a training class with your employees. Provide each employee with a copy of the plan if it's revised, and make sure that the plan is posted in a visible location. So the New York State Department of Labor has created plans for employers to follow. And this is really great because it gives you the whole guideline. So you don't have to reinvent the wheel because you've got enough to do. On the right-hand side, we're talking about the Airborne Infectious Disease Exposure Prevention Standard. My suggestion is that all of you read this standard in detail because it talks about the commitments that you are making, the requirements that you are required to abide by in order to make sure your plans are in place. On the left-hand side of the screen is where you see the Model Airborne Infectious Disease Prevention Plan. So this prevention plan is a non-industry specific model plan. It's commonly used for the office. You will also see underneath these two that you see these same exact plans and models in Spanish. So far the New York Department of Labor has only made this information available to us in Spanish. Now, as you go further down the website, you're going to see that there are industry-specific plans that are tailored to the needs of specific industries. So in many cases, companies may have more than one plan. For example, in manufacturing, companies may use the manufacturing and industrial plan for the plant and the model plan for the office. Each plan has to be tailored and specific to the hazards that are specific to the industry and the work sites. So employers who use the model plans, which we suggest, do not need to solicit employee feedback. But employers who develop their own plans are required to review the plan with all employees before it's adopted. So it really makes a lot of sense to use what the Department of Labor has provided to us. Now, why do we want to do this? First off, we're required to do it by law. Second off, we don't want to be on the front page of any newspaper or social media saying XYZ company is not paying attention to the New York HERO Act. Yeah, on top of it, there are penalties. And I want to avoid these penalties for you. So it can be $50 or more per day for not creating a plan. It could be anywhere from $1,000 to $10,000 for not following an adopted plan. Employees can also bring a private suit of action against you. And then the HERO Act also prohibits retaliation against employees who exercise their rights, including asking questions about compliance with the safety and health plan. And on top of it, repeat violations can result in increased penalties. So let's take the revenue that you are earning and continue to build your business instead of paying for penalties. So now let's talk a little bit about the verbal review of the plan to employees. We need to talk about employee policies, the rights, and the employer's exposure prevention plan. Such a verbal review has to be in person. And if it's in person, we have to make sure we're following all of our social distancing guidelines in a well-ventilated environment with face masks, or employers can do it via audio or via video conference technology. This does not mean you are reading the whole plan to employees. That just doesn't make any sense. but there are certain highlights that we need to provide. PMP can help you with what this verbal review should include and what options you have in communicating this information with your staff. Okay, let's take a look at the website, the New York State Department of Labor website. I want to call your attention to a few things. Here is the cover page. The cover page is the overview. The next page talks about responsibilities. So here we need to be very clear about the name of the company in the top box. And if there are numerous locations, we have to talk about all and list all the specific locations where your employees work. Now, if anybody is in an industry where we have people working in different locations, perhaps every other day, every other week, every other month, you can include a standard line here saying, and all locations where employees of XYZ perform work. On the bottom half of the screen is where we're talking about who are the specific people who are responsible to ensure compliance with all of the plan elements. So these individuals have to be designated. If you designate somebody today and that changes 3 months from now, that is considered to be a change to your plan, and that will have to be reissued to your staff. On the next page, you're seeing these exposure controls, and these are minimum controls during an outbreak. We've all seen this. We've all been doing this, hopefully, since March or April of 2020. Providing a general awareness, having a stay-at-home policy, health screening. We're going to talk about that in just a minute. Exposure controls. Now, the health screening I want to call attention to because since this plan is now in effect, because COVID is an airborne infectious disease, your health screening performed on a daily basis should have started on September 6th of 2021. So the questionnaires, whether it be in paper, via app, via questions that you have with people who are walking in, whether it's including the temperature screening or not, they should be being done every single day since September 6th, and we have to keep documentation of that. Many employers are not quite aware that that's part of the current regulations and rules. It then talks about face covering, physical distancing, hand hygiene, cleaning and disinfection, respiratory etiquette, and then we're getting into where we have to fill out some information. So here we're talking about advanced controls during an outbreak, which today is an outbreak. We're now in an outbreak. And I've circled engineering controls because here the DOL is giving us an understanding of what are samples and ideas of what could be engineering controls. This is not the end all be all. You and your company may have things that are beyond this, because on the following page is where you're going to list what you're going to do. So it needs to be specific. It can't be general, because again, remember, your employees are reading this and you don't want somebody making a complaint where suddenly the DOL is knocking on your door saying, what's with your plan and let's review it. The next page talks about administrative controls. These are additional controls where the DOL is giving you an understanding and an idea of what you can include on the following page where you're going to need to be specific. Okay. Then on the following page, it talks about personal protective equipment. What do you provide? How often do you provide it? Where is it located? Provide information about all of the PPE that you are making available to 100% of your employees, regardless of the location that they're working. Then it talks about housekeeping, which is important for you to take a look at. It's important to look at what's an infection response. And then under number 5, you're going to need to designate a person here. So I would say it would be the name and title will verbally inform all employees of the existence of, and so forth. So there's a lot of information to fill out here. It then on the following page talks about when the plan is activated, and then the plan evaluations during a designated outbreak. Here is where you are designated, perhaps for the first time, that you have adopted your plan, the date that you distributed it to all of your employees, and here's where you're keeping track of all the dates where you're making additional revisions, major changes, and who were the participants. The last page clearly talks about no retaliation, and retaliation is clearly against these regulations and against the law. So when an employee is going to be asking questions, is concerned about something, says that they want to talk to other employees about it, they have the ability to do it, and we cannot take any adverse action against them. Otherwise, it'll be claimed that we are retaliating against employees. Now, another piece to this is that it says very clearly in the regs that employers are required to add the HERO Act plan to the employee handbook. The HERO Act plan is 10 pages long. I have many employers and clients of PMP who are adding it to their employee handbook. We've got others who are adding it as an addendum. So this way it's not integrated into it, but it's part of it as in its integration. And the design and the reason behind this is that we're all hoping that COVID's going to go away one day. So it's a lot easier to take away an addendum than it is to revise an employee handbook. But yes, it does have to be part of the communication to all of your employees. Lastly, I want to touch on very, very quickly on the New York HERO Act and the forthcoming OSHA Emergency Temporary Standard. So we've heard on September 9th that the Biden administration announced that OSHA is developing a standard that's going to require large employers with more than 100 employees to ensure their workplace is fully vaccinated or provide a negative test at least once a week. The New York State Department of Labor has indicated that it's going to be providing forthcoming information regarding whether employers who are subject to this OSHA standard are relieved from complying with the HERO Act once that standard is issued. So as things have been changing since March and April of 2020, they continue to change. We've never been here before. We're all kind of working towards making sure that we've got the protocols and the policies in place, and most importantly, that we are safe and that we are healthy. I want to thank you very much, and I think we are on to our next presenter.
Cool. Thank you very much. So, excuse me. Thank you, Barbara, for that wonderful briefing. I will ask if anybody has any questions for Barbara, please shoot them to the chat now while you're doing that. I also want to ask if, Barbara, do you think that maybe once the new OSHA standards come out, we should do another one of these to talk about the new OSHA stuff?
Well, let's see what the standards are. And at the least, Patrick, I'll make sure that I update you, and maybe we can get an email out to everyone who attended today. Let's see the depth of what it's about. So yeah, we're happy to provide that.
Definitely. And then I think you also mentioned that there will be new guidelines and new guidance from DOL coming out in early November. So I think that we'll definitely need another follow-up briefing or email, whatever you want to do for our membership as well in that regard as well, Barbara.
Yep, November 1st is Monday, so it's not too far away. So we have to realize that hopefully on Halloween, we're going to get some information. I see a question in the chat. What written guidance has the Department of Health and CDC provided regarding mask wearing at work? If everybody is fully vaccinated, there's no requirement to wear masks at work. It's a company's choice. And we still have companies who are making a proactive choice to say if somebody is around the office and interacting with individuals, that in those times we're wearing a mask. We're doing that actually in our office.
Excellent. Any other questions from the audience? Okay, so finally, Barbara, what is the best way for our audience to get in touch with you?
So my email address is bdematteo@pmphr.com. And hopefully you can send out a list of all of our contact information to all the attendees.
Absolutely. Sure, of course. No problem. And I'll try to, if you can, send over those slides to me and I'll get those out as well.
Thank you.
Thank you, Barbara. So in one of the things that Barbara mentioned was the engineering controls that employers can use to help make their workplaces a little safer. In that regard, I want to talk to Dennis Cody about what he has been doing, what technologies he's created to help fight the virus. Dennis, if you could take yourself off of mute, and before you start, I'll just ask the other panelists, while Dennis is talking, if you could just turn off your cameras, that way Dennis gets all of the limelight, which I'm sure he would hate.
The last thing I need.
Thank you, Dennis.
But thank you, Patrick. Yes, thank you for joining this webinar. I believe it's very important to be able to get this information out to everybody. My name is Dennis Cody. My company is Denco Environmental Solutions. I've been in the facility management environmental services business for over 35 years. We've worked with schools, hospitals, manufacturers, every type of building that you can imagine. We also EPA certified in indoor air quality. We're here to help you get compliant. And that's the focus of both Barbara, myself, and everybody here, to make sure that your business runs without interruption, without fines. And the plan is one thing, the implementation is another. because we realize this can be very expensive, but by the same token, so can the fines. Yeah, and everybody misconception that vaccinations were going to cure everything. It's not. All it does is keep you from being very sick or hospitalized or even death. But breakthrough infections are all over the place. So we've got to be able to approach this the way we did previous vaccinations, and that's by mechanical and actual sanitation and disinfecting. People don't realize that, well, maybe you do. The COVID is like a flu or even a cold. It transmits two ways. One through respiratory droplets, whether you cough, breathe, even if you have a mask on, they can escape. And the other is those respiratory droplets fall to a surface. You touch that surface, you touch your face, and you're exposed to COVID. Masks are very important for this purpose, but then again, if you're not careful and the contamination can actually go onto the mask, we found. You touch the mask, you take the mask off, you touch your face, you're contaminated. Okay, so our goal here is to be able to go one step further. What we've been doing with our clients is we take a two-step approach: air sanitizing and surface disinfecting. Air sanitizing can be anything from HEPA filters, which work well, but require a lot of maintenance and have to be handled carefully because it doesn't kill the virus. It's still on that filter. That filter has to be changed often. And so there has to be treated as a hazmat material. We utilize a technology called photocatalytic oxidation. And what PCO does is it's a titanium mesh that's energized by UVC light that either goes into your HVAC system or can hang independently on the wall with its own circulation system. PCO is a NASA borrowed, if you will, FDA approved air sanitizer, and it actually kills the COVID or all germs and other pathogens as it moves through that filter. So you're not catching it, you're killing it. And the only thing, and it can circulate and you have a pretty much germ-free environment. We also are using for surface disinfecting. Remember, droplets can live in the air for up to 6 hours. They can travel through a building through the HVAC system. Nobody is safe in a building, because somebody coughed in that corner over there. Once they drop, though, they drop onto all sorts of surfaces, from doorknobs to desks to computers and so forth. And when you're touching those things, unless you're wearing gloves, and again, they transfer from the glove, you have an opportunity to be contaminated yourself and get sick from COVID. So surface disinfecting is very important, but it's also very expensive. It can be very, laborious man-hour-wise. So what we've been doing with our clients is we've introduced an antimicrobial. We disinfect up once, and then we apply this antimicrobial, which kills all pathogens as it tries to land on the surfaces. This is antimicrobial lasts for 12 months. So one application for 12 months, as opposed to disinfecting every surface 3 to 4 times a day. Okay, and when we worked out the price, the ROI is considerable against using Lysol. Okay, so we're recommending that. We're recommending also with the mechanical fresh air circulation. You've got to get the air in your building moving, okay? Because stagnant air holds on to the virus. Even if you're not in the HVAC part of your season, keep that system on to make sure that you're exchanging air and it's not staying stagnant. And follow the basic protocols. Wash your hands, wear your mask, keep 6 feet apart. This is not over. People are still getting sick, and we don't want you to have absenteeism, have a fine, reduce production, all those things that come with an outbreak in your facility. You've seen it. It's been part of the supply chain crisis that we're in right now. Yeah, there are other reasons, but one of them is because for a year we were not producing at the levels we needed to, and now it's backlogged, and we're paying the price for it. So again, my name is Dennis Cody. It's Denco Environmental Solutions. I can be reached at dennis@dencoenvironmental.com. Our website is dencoenvironmental.com. If you'd like us to come out and look at your facility, because we do all custom work, we can come out and give you an idea of what needs to be done to be compliant. We can give you an idea of what it's going to cost you to continue ongoing, and we can handle the work for you. Thank you.
Excellent. Thank you very much, Dennis, and thanks for all that you're doing to help fight the virus. Dennis, if you could take yourself off camera, I'm going to ask Alex to come on. There you are, Alex. Alex is going to tell us a little bit about the insurance implications for this new legislation and how being out of compliance can seriously impact your work environment. Alex, if you want to jump on in.
Yeah, thanks, Pat. Thank you for organizing the discussion today. Good morning, everyone. My name is Alex Sarkin. I'm a risk management consultant at Industrial Coverage. Pat, do I need to do something with my screen here?
Sorry, you're good. Do you want to share your screen?
No. Okay.
Okay, good. Yep.
All right. We at Industrial Coverage have the privilege of being a part of Ignite Long Island. We are a third-generation family-run agency located in downtown Patchogue and have specialized in ensuring all kinds of manufacturing operations for over 50 years. So a couple things from an insurance and risk management perspective regarding the HERO Act. So the first thing I wanted to discuss with you all was what you can do to prevent and defend claims, should they arise out of, from a COVID situation. So we really want to focus on those two things today, putting yourself and your business in the best position possible to prevent any claims from happening in the first place. So that starts with implementing the HEROES Act plan that Barbara has outlined, that Barbara outlined earlier today, and then also any other safety protocols, as Dennis mentioned earlier. Those all go a long way to preventing any possible claim from happening. But then, should a claim, should something happen, should a claim arise, you want to be in the best position to defend that claim. So that starts with documentation. I know Barbara mentioned that earlier. Documentation is key. You got to make sure that all the employees are notified and are trained, that that their compliance is well documented, so that if all of a sudden you're hit with a suit, that you have everything organized, documented, so that you can you can prove that that yes, the plan was in place, that yes, you took those additional measures to operate as safely as possible. Because you could, may be obvious, but you can leave yourself vulnerable should all of the required plans not be in place. And then secondly, I wanted to discuss with you all sort of the insurance structure. From the insurance standpoint, there's not a huge immediate impact regarding changes to policies, and structure of those policies. While you may have been seeing some communicable disease exclusions pop up, other than that, there's not really any changes to your liability policies from structurally. Although most policies have a provision for known or intended injuries. So there could be a situation where if you're not adhering to the policies and plans outlined by the HEROES Act, that you could be in a situation where maybe your carrier deems that that you're intentionally putting employees or or customers in danger. And there could be, you could be in a situation where, a claim that would have ordinarily been covered, would you have had those plans and protocols in place? Now you don't have coverage. And then getting back to the communicable disease exclusions, a lot of carriers have been putting those communicable disease exclusions on policies. Some are stricter than others. So we would highly recommend that you review your current policies with your agent. We're also happy to help you with that, so that you better understand how your policies may respond should there be a claim, and whether or not you would have coverage for, in certain situations around the HEROES Act and around COVID in general. And then from a workers' compensation standpoint, it's a little bit more straightforward than general liability. It's really up to the workers' comp board to determine what would be the ramifications, and what would be the kind of fallout from COVID in the workplace. So on that note, I'll open it up to questions if anyone has any questions from an insurance standpoint on the HEROES Act. But that was really what I wanted to discuss with all of you today. Was really do your best to obviously prevent any claims from from happening in the first place, and then put yourself and your firms in the best position to defend them should they come in, and make sure that you're well aware of any exclusions or limitations on your policies around communicable diseases.
Excellent. Thank you, Alex. And thank you for always being such a wonderful partner of IgniteLI. Alex, as we see new guidelines come out and as updates are made, how would our audience get in touch with you?
Yeah, so I can shoot my my email and number into the chat here, and what we can follow up with everyone via email after the discussion today. But feel free to drop me an email or give me a call. We're happy I'm happy to make I'm obviously available to all of you. And then we have a pretty sizable team over here. If there are any more specific questions that that you guys have regarding this, or anything from an insurance standpoint.
Very good. Well, thank you very much. Thanks for being here. Okay, so
Thank
we're
you,
running
Ben.
really ahead of schedule here. I got one more speaker, Jamie Moore. If you could come on camera, unmute yourself. Alex, if you could turn off your camera. Jamie Moore, you are up. There you are. How are you?
Good.
All right. So, so Jamie's going to talk a little bit about some aid that he can give to help companies get into compliance, and also a little bit about some grants and some of the other work that Jamie's been doing to help the manufacturers. Jamie, the floor is yours.
Sounds good. Thank you very much, Patrick. So I'll just go back to what Barbara was saying on filling out the paperwork required for the HERO Act. Both Barbara and I provide the services to help you have those plans put together. New York State has done a very nice job of presenting templates, but they put them in PDF format, so they have to be retyped. And then there's a number of things that need to be done just walking through your shop floor or your offices to customize it correctly for your organization. So certainly if you were looking for some help for doing that, Barbara and I can both help you through our respective organizations. The next piece, and the piece that the grants are out there for that could potentially help, is when you go for the larger scale changes for disinfecting solutions, et cetera, and some of the stuff that Dennis Cody was talking about. So with what Dennis has and the machinery that you can put in place, either through the HVAC systems or the disinfecting solutions, or the UV lighting and a number of other things, that can be part of grants that New York State has for capital investments in your facilities. So that's something that's worth looking into, especially if you have a CapEx budget on an annual basis that you're already putting in place. This can be added in, and you can see anywhere from a 5 to 15% reimbursement on your investment there. One of the things that I would say is really worth noting and pushing, and Dennis, you may have touched on this in what you were saying, but we're at a very difficult point, especially in manufacturing, but across the board, in finding skilled employees and keeping skilled employees. And so we're looking for every competitive advantage that we can, especially on Long Island, where you have a high cost of operations and a high cost of living. This is another piece that is going to become more and more important when you're talking about workplace safety, the ability to provide a healthy atmosphere for people, and also cuts down on sick days and increases productivity, because it not only deals with COVID, but the flu and anything else that is transmitted in this way. So I think it's very worthwhile to look at making this investment, and then look at the potential funds that are available in order to mitigate some of those costs.
Excellent. Thank you very much. And Jamie, what is the what's the best way that folks can get in touch with you?
So I'll put it in the chat, but it's my email, jamie.moore@industrygrants.com. And what I do is I kind of cover all the stuff you see on the screen behind me with the funds that are available from New York State. And I also really enjoy making connections for people, to folks like Alex and Dennis and Barbara, to give them kind of a comprehensive solution to a lot of the issues that companies face.
Great. Well, thank you very much, Jamie. Thanks for doing all you're doing, and thanks for guiding me every day and helping Ignite keep rolling. So I'm going to just open up any questions from the audience. This would be your time to ask. And while you are typing out your questions, I will just also, I want to say a special thank you to the IgniteLI Board of Directors for all their support and everything that they do. Jody is on the call with us today. Thank you, Jody, for being here. I want to thank IgniteLI sponsors, Alex Sarkin and the crew. Obviously, we couldn't do this without you. So if there are no other questions, we'll go ahead and get everybody back to work early. I'm sure you'll be happy to do that. So thanks again for being here. Stay tuned for more events from IgniteLI. We'll be putting together some networking events, and we'll be happy to see you soon.
Thanks, Pat.
Thanks, everyone.
Thank you, Patrick.